Hi, so good morning, everyone. Thank you for joining us. I'll try to speak a bit louder because I think sometimes on internet it can be a little bit difficult. So I'm Rilong. I'm going to be taking us through heart failure management made easy. It's a little bit of a big topic, but we'll do our best to get through it. Today, I'll be covering the four main contents. One, managing the underlying cause of heart failure. Number two, mitigating precipitating factors. Number three, heart failure specific therapies. And then finally, a little bit about advanced therapies. So I think with anything in medicine, if we can manage the underlying cause, that would actually definitely be the best way to treat the problem. So as we know, heart failure is a final common pathway of poor heart function, but there are some common causes that we usually talk about. One would be heart attack or coronary artery disease. Another would be high blood pressure causing hypertension-induced cardiomyopathy, rhythm problems, and of course, valvular heart disease, which are problems with the valve. There are also many other causes of heart failure, but I think we'll focus a little bit on the more common ones today. So with respect to managing coronary artery disease is really the plaque buildup in the heart arteries. As it gets narrower, it gets more difficult for blood to flow through the coronary arteries. And then finally, if the plaque breaks and a clot forms, this can cause an acute blockage. This is what we know as heart attack. So in order to manage this, there are lifestyle factors that we have to manage, such as stopping smoking, and as Dr. Chai mentioned, exercise and diet is important. Controlling our risk factors like diabetes, cholesterol, and hypertension. Blood thinners like aspirin are very important in the management of coronary artery disease because as you can see, if a blood clot forms, this can block the artery. Things like statin, which is a popular and common question that we normally get, are important. Statins are not only cholesterol medications, they also have pleiotropic effects, such as, which means effects beyond lowering cholesterol, things like reducing the overall inflammation, and also to stabilize the plaques within the arteries. Finally, we sometimes need to undergo invasive procedures such as coronary angiograms and angioplasties, which are colloquially known as ballooning and stenting. Some of you may be familiar with this. The next thing that we talk about is hypertensive heart disease. This is where high blood pressure, chronic high blood pressure, actually damages the heart. It causes abnormal remodeling or changes in the heart, and in turn, in the long term, this can damage the heart. It can also damage the heart in a few other ways. It can increase the risk of some of the rhythm problems, which I'll talk about later. And in patients with dilated aortas, this can actually worsen the dilatation. The way I like to think about this is that if you have a pipe and you have high blood pressure in the pipe for a long period of time, the pipe can burst. The other way I like to think about hypertensive heart disease, it's like if you did weights only during exercise, that's good for your heart, of course. Stressing the heart intermittently with exercise is good. But if you are doing weights every single day from day to night without any rest at all, your muscles will get damaged. So if the heart is fighting against a high pressure all the time, the heart can eventually get damaged. The next thing we can talk about is valvular heart disease. Valves are really doors in the heart which allow blood to flow in one direction and not back in the opposite direction. And so, as we know in life, anything that can go wrong sometimes goes wrong. And so if the door becomes very tight and it's not able to open properly, this is what we call stenosis. If the door cannot close properly, if you compare to a normal closed valve, this is known as regurgitation. In stenosis, the heart has to force and fight against a very tight hole. And in regurgitation, every time the blood goes forward, it goes backwards again. In so doing, this can cause long-term damage to the heart and eventually causing heart failure. The treatment for this is usually surgical in nature, meaning repairing or replacing the valve. The final common cause of heart failure, which we will touch on, is something we call arrhythmias. These are abnormal electrical conductions within the heart. This conduction system is important because this allows our heart to beat. So when the conduction in the heart becomes chaotic, as you can see from the diagram on the right, it causes the heart to beat in an irregular fashion, which is often very fast. The way I like to think about this is that it is like your heart running a marathon all the time, even when you are sleeping. And in the long run, this will cause damage to the heart. The treatment for this is with medications, managing the lifestyle risk factors, and also in some cases, putting in wires into the heart to isolate or burn away these abnormal circuitry. In some patients, this actually causes a reverse remodeling in the heart, meaning that the heart failure eventually goes away. Yep. Okay. So now that we've talked a little bit about managing the underlying causes, let us talk about mitigating precipitating factors. This means that in patients who already have heart failure, there are some risks that can make the heart failure become worse and cause acute fluid overload, where the patient ends up with an additional buildup of fluid in the body. So some of these things that have proven efficacy include vaccinations against influenza in particular and pneumococcal. Includes reducing or managing our salt intake. It includes exercise, as Dr. Chai has mentioned. Includes management of our fluid. Well, this one is quite important because we only often think of fluid management as only juices and water. But actually, it's also important to know that some fruits, such as watermelon, contain a lot of water, and even the soups and porridge that most of us eat in our daily lives also constitute the total amount of water. Okay. And then finally, it's also important to manage our overall frailty. Frailty meaning how much, how weak we are, how much reserves that we have. So if we can maintain a good level of nutrition and exercise and diet, this gives us a little bit of reserve, meaning that when we fall ill, we are able to recover. Okay, so tried to go through that quite quickly. Now we can talk a little bit about heart failure specific therapy. When we talk about heart failure specific therapy, we normally mean medical therapy directed at heart failure with reduced heart function. As we had learned earlier, heart failure takes on many forms. But one of the common final pathway is the heart itself having poor ability to push blood forward, resulting in a reduced ejection fraction. So heart failure specific therapy mainly geared towards this. Some of you who are yourselves heart failure patients may be familiar with the 4 pillars of heart failure, what we call 4 foundational therapies. These actually have been proven and are agreed upon with the 3 major societies and even our Asian societies, such as the Japanese Society of Heart Failure. So these 4 therapies are ACE inhibitors and ARNIs, beta blockers, MRA, known as mineralocorticoid receptor antagonists, and SGLT2 inhibitors, known as sodium glucose cotransporter 2 inhibitors. These are very fancy names, and I don't expect any of you to really remember them. But just to know that there are 4 medications that work on different pathways that actually serve to improve not only, it actually helps to reduce the risk of death, but also improve the quality of life. Improving the quality of life via reducing symptoms and reducing the heart failure hospitalizations. So this slide is just to reiterate that in heart failure with reduced ejection fraction, which is one of our more common forms of heart failure we deal with in the hospital, these are the 4 main pillars, and these serve to, as I mentioned, reduce death and also improve quality of life. If you are there are actually still some other medications that can also be explored, but this one will be on a case-by-case basis. Okay, the next question that most people have in their mind is, I'm already on medication. How come my doctor, every time I see my heart failure doctor, they keep increasing my dose of medications? Well, the reason for this is, even if you feel well, we know that from our studies, such as this recent study done, which is called the Strong Heart Failure, Strong HF study, it is shown that patients that were put into the arm where they rapidly increased the medications, the 4 medications that we mentioned, we know this as GDMT or goal-directed medical therapy. If we are able to achieve the full dose early and we follow the patients for up to 90-day follow-up from the end of 6 weeks, meaning 180 days in total, it actually demonstrated a 26% reduction in death, 44% reduction in heart failure admission, and even a 16% reduce in all-cause death. This is just over 180 days. And this is not against patients who never take medications, but this is in comparison to patients with the usual adjustment practice. So we know that, in summary, we know that increasing dose increases better outcome. Okay. This one is just a very busy slide. Nothing for those of you who are interested, who take diuretics, or especially heart failure patients, you'll be most familiar with something we call furosemide. And this is just to explain that there are many types of diuretics. Diuretics are medications that help to pass the urine or water out of the body. There are many types, and they all act in different pathways. And sometimes we may require more than one in order to achieve achieve the desired outcome. Okay, that one, I think let's not bother too much. Finally, let's come to advanced therapies, meaning in patients with advanced heart failure, what else can we do? So in terms of cardiac support, there are medications that we can infuse into a patient. We know this as IV or intravenous medications. There are two types that we commonly use. One is called dobutamine, the other is called IV levosimendan, and these medications serve to temporarily increase the contraction of the heart. This may allow the patient to get over a very bad case or precipitate or worsening case of heart failure, sometimes giving us the opportunity to increase some of the previously mentioned goal-directed medical therapy, and sometimes actually keeping them out of hospital for a protracted amount of time. Yeah. The other one that you may be familiar with is something called ECMO, which had gained a lot of publicity during the COVID period. A colloquial way of thinking about this is a heart-lung machine. What it does is it extracts blood from the body. It gets pumped into an external pump, oxygenated, and reintroduced back into the body. Again, to highlight, these things are temporary. They only allow us to get across a very short period of time, and we still need to find a long-term solution, either treating the underlying cause, as we had mentioned previously, or bringing us to the next point, which is transplantation of ventricular assistance device therapies. Left ventricular assistance device is an external device that allows blood to be sucked from the left ventricle and pumped into the aorta, bypassing the poor left heart function. This requires an external battery and controller, which the patient has to carry around all the time. There are also multiple complications that can occur as a result of this. So this needs to be thought through carefully before implantation. And of course, the direct transplantation of an actual organ is another long-term possible solution. Although, you must ask yourself, where are you just going to obtain a random heart? So it is quite difficult sometimes to get. Okay. And I think I would just like to leave this, to end off this portion of the talk by talking about advanced care planning. Because whilst advanced therapies are important, by the time we reach advanced heart failure, we really need to think about how we want our treatment and care plans to happen for us. The reason for putting this diagram here is to illustrate the fact that in heart failure, the change or the time course of heart failure can be quite different. So compared to other diseases, such as cancer, which has a more kind of linear regression, meaning that you go from good state to poor state in a very clear fashion. But in heart failure, as you can see, the patient may initially start off at 1, but because they respond to therapy, they actually maintain a very good function for many, many, many years. But there will come a point, or can come a point, where the patient deteriorates. But instead of a very straight line going down towards death, there can be many, many rebounds. And so what does this mean for most of us? Well, it means that it can be difficult to predict exactly when or where this clinical instability will occur. Therefore, it is important to talk about advanced care planning at an early stage. Yeah, because we want our families and also ourselves to be able to communicate our treatment and care options. Yeah. So with that, I'd like to thank everyone for your time, and we'll be happy to take questions later.